The Republicans shut down the government because it delays the Epstein discharge petition from moving forward. That's clearly why Mike Johnson hasn't sworn in Adalita Grijalva. He says he won't do it until the shutdown is over. So that's what this is about for them. But for Democrats, it is about healthcare. And not just healthcare, the entire healthcare system, hospitals, doctors, nurses, patients, everything. And I'm going to explain to you why. But first, make sure to subscribe, like this video, and we'll get into it. Democrats want essentially two things. They want the Affordable Care Act enhanced subsidies that were created during COVID that covered more people to be extended. It's been extended already. They want it extended again because people are relying on it. If they cut this out and don't extend it, there are going to be roughly 40 million potential people that lose their health insurance because the costs are expected to skyrocket upwards to 300%. That is just simply unaffordable for most people, and early retirees would be hit the hardest by this. For everyone else, without these enhanced subsidies, they could face insurance premium increases up to 114% on average. We are talking about the group of people that are in the most need of health insurance when they're entering a stage of their life where they're going to experience more medical issues just because of their age, and they need to go to the doctor and have coverage for this, and they will be affected the most. To be clear, the Democrats want this enhanced healthcare subsidy extended permanently, not for a short term like it's been done, so they have to go through this again. They want it done permanently. Now, the other major thing they want is the restoration of the healthcare cuts that came from the big, beautiful bill. They want all of that back, and that includes SNAP benefits and the Medicaid cuts. Republicans are now arguing that the Democrats want to provide health care for illegal immigrants by doing this. That is just simply not true. That is against the law. It's not in the text of the document. It's not what they want to do. Plain and simple. If they're telling you that, it's a lie. But what it does do is that it allows immigrants that are here on a legal status to get health insurance. So yes, they can get health insurance, but they are not here illegally. They are here under some sort of legal status. They are paying taxes. Most of them are on a pathway to citizenship through our very complicated immigration system, and they are doing it the right way, the way Republicans want them to do it. So why should they not be entitled to get health care coverage? Now, let's talk about why not extending the enhanced healthcare subsidies and not restoring the healthcare cuts from the big beautiful bill will be so dangerous and so damaging to our healthcare system. It will force millions of people off their health insurance. They simply won't have it. But these people, many of them, will still get sick and need to see a doctor. So what will they do? Well, what it means is our emergency rooms will start getting filled up with sick people. People who could just normally go to the doctor but can't afford it now. And they will go to the emergency rooms, clog the emergency rooms up, and so people with actual emergencies that need help will have to wait longer. By law, the emergency rooms have to provide care to these individuals, whether they have insurance or not. So these people will get the care that they need. They'll get a bill later, and then they probably won't be able to pay for it. And when that happens, the hospitals are going to suffer because they're going to have all these medical expenses. They still have to pay their staff, they still have to buy supplies, all that, and they're not going to be getting the revenue to pay for it. If this starts happening with millions of patients across the country at all sorts of different hospitals, we could see a collapse of our healthcare system. That's why this is so important, and that's why it's so reckless for Republicans to not even be dealing with this, not even coming back in the session in the House to talk about it. And when we see hospitals start to not receive payments and go under and close down because of it, that's going to be on the Republicans. The healthcare system is already incredibly fragile, as we learned during the COVID-19 pandemic, and we should be bolstering it up and making it stronger, and the exact opposite is happening. Trump has said now for 10 years plus that he had a plan for insurance to replace Obamacare, or he had concepts of a plan. We still have yet to see any of that. And the reality is, he has no plan. The Republicans have no plan. They have nothing. So they need to get on board with this, because messing around with healthcare is a major problem for virtually every American in this country. It's one of the top priorities every household has. And since we're talking about hospitals, this government shutdown is going to affect them in a much larger way that no one is even really talking about right now. The Democrats in their CR bill want to extend the enhanced advance premium tax credits and the disproportionate share hospital funding. The Democrats want these programs extended permanently, and they should be at their current funding levels, because one helps lower the health insurance premiums of some patients, and then the other helps provide extra funding to hospitals that serve predominantly lower income families. If they cut the disproportionate share hospital funding, this is the money that helps cover the costs to provide medical care for uninsured patients. These are the people I was just talking about that would lose health insurance and have to come in uninsured and probably not afford it. So this funding helps pay for that. And if that's gone too, along with everything else, we are going to face a major crisis in our healthcare system. In conclusion, Democrats want to restore the health care cuts that Big Beautiful Bill had in them, and they want to maintain coverage for millions of Americans through extending the subsidies permanently. Republicans don't even want to talk about it. They don't want to do any of this. They don't care. They would rather have their rich friends and funders have their big tax cuts than provide health care for millions of Americans whom they represent. The Democrats' proposals have wide public support, and the Republicans know this. And now, today, on No King's Day, they're going to see how much support they actually have. And what's even crazier about this is that the Republican states will be disproportionately negatively affected by their inaction to not deal with these healthcare issues. I mean, talk about shooting yourself in the foot. Let me know what you guys think about this in the comments. Subscribe to my channel, like this video, share it with your friends, and I will see you back here for the 411.